Welcome to the 16th episode of Insights webinar. This is a public health webinar series hosted by eHealth Africa. The webinar series enables insightful conversation with public health professionals and do discuss pathways for improved public healthcare delivery. My name is Tokpe Ogunsheye Falodun, an associate manager at eHealth Africa. I'll be your host. I'll be the moderator for today's Insight webinar conversation. The topic of our webinar today will be discussing around scaling electronic medical record for better healthcare delivery. Amongst the area of emerging digital health innovations, electronic medical records, we all know it's gradually replacing the traditional information storage systems. The storage of patients' medical records is highly or gradually becoming an inevitable tool in hospitals and amongst healthcare professionals. As we all know, this innovation, according to the National Center of Biotechnology Information, has to a large extent reduced medication errors, adverse drug reactions, and improved compliance to practice guidelines among healthcare professionals. There have also been concerns around the financial implication of developing and implementing electronic medical records, especially in medium-income countries. Also, there are concerns about existing policy frameworks that impacts on effective design and implementation of electronic medical record. I will be using the short form of it, which is EMR. So especially in developing countries, all these are the concerns. Similarly, ethical and legal issues like data protection and privacy have proven to be fragile, especially in these countries that I mentioned earlier. So in this vein, this episode of this Insight webinar will delve into these sensitive but yet crucial issues as we discuss the barriers, prospects, and recommendations on how to scale the implementation of EMR in developing countries. So welcome once again, everyone. At this point, I will be welcoming the Deputy Director of Programs, Dr. David Akpan, to give a warm welcome. If David is on the call, the floor is open. Over.
Yeah, thanks, Dr. I'm here. Okay, thank you everyone for finding time to join the call. Yeah, so this is another version, another edition rather of the Insight webinar, and we're super excited to host this particular edition, basically looking at what's the value add with EHR. Some people call it EMR, all of that. But basically, it's important to discuss this in the context of improving access to healthcare. So this kind of conversation for us, it's in the light of how we could optimize the use of technology to reach universal health coverage. So it is quite exciting to see that we are discussing this at the moment. And then for us, all very much excited to have panelists who had also worked in this space, with great experience to share. And so we hope to benefit from the wealth of knowledge and experience that they will be sharing today. And we employ that our participants definitely will gain a lot of insight from this. And we'll see what the application looks like. And we're going to speak into several use cases and then demonstrate the value add for this and how this can also be upscaled in a different context. So happy to have everyone, and let's go into the session and gain the insight that is relevant. Good afternoon from here.
All right, thank you very much, David. And thank you once again, everyone, for joining us. The room is full with knowledge expertise. Our panelists today are seasoned public health experts with huge experience in the area of developing and implementing EMR. So I'll start by introducing Abdulhamid Yahya. He is the Deputy Director, Global Health Informatics in the ICT Services at eHealth Africa. Abdulhamid is the lead on information communications, technology, help desk, DevOps, and business application teams across Nigeria, Sierra Leone, and the Germany offices of the eHealth Africa. He holds a BSc in mathematics, MSc in computer science, and an MBA from Bayero University, Kano. He went on to acquire the Lean Six Sigma training and has a certification in process reengineering from Terry College of Business at the University of Georgia in Athens. Over the course of the decade, Abdulhamid has earned several other professional certifications and provides mentorship on cybersecurity to other executives and professionals in the IT sector, and guides them to gain their own certifications. So welcome, Abdulhamid.
Thank you very much, Tope. Thank you. It's a pleasure to be here. Thank you.
All right, thank you very much, Abdulhamid. Our next panelist to be introduced is Dr. Raphael Akangbe, Health Information and Informatics Expert. Dr. Raphael Akangbe is an accomplished digital health and health informatics expert in information management. He is a consultant and a lecturer with over 20 years of experience, both in healthcare system and high institutions of learning internationally. He is the founder of 72.0 Health Limited, a fully registered digital health technologies company in Nigeria that focuses on electronic medical record and electronic health record, telemedicine, and telehealth, AI in healthcare, machine learning, data analytics, healthcare data protection, among others. He has a bachelor degree in health information management, an MSc in health informatics and information management. He has a Doctor of Business Admin and PhD in Health Information Management and Health Management Information System. Also a PhD in Digital Health Informatics. He is a prominent local and international conference speaker and have authored many books on public health. So join me to welcome Dr. Raphael Akangbe. You're welcome, sir. Dr. Raphael, over, you're welcome.
Thank you very much. It's my pleasure to be here. Thank you very much.
All right. So next on the panelist list is George Ohia, Senior Software Designer at EHA Clinic. George is a seasoned software engineer with a strong focus on health informatics. As the engineering lead at EHA Clinics, he is at the forefront of developing innovative solutions to support frontline health workers in low-income communities. With a career marked by commitment, George has led a team in creating an electronic medical record system that significantly improves clinical workflows, data interoperability, and quality improvement initiatives. He has successfully integrated health informatic tools and standards into real-world applications, enhancing patient care and streamlining healthcare processes. George's extensive knowledge of health informatics and technology combined with his experience in agile project management and DevOps practices makes him a vital resource for those interested in healthcare and cutting-edge technology. So you will join me to welcome George Ohia, and you will agree with me that the house is filled with knowledge experts. Welcome, George.
having a meaningful conversation. Thank you very much.
All right, thank you. So welcome again, all our panelists and our participants. So we'll go right into our discussions for today. We all know, or maybe we may not know fully what the electronic medical record is. So George, can you please tell us what electronic medical record and what it is and how it works?
Yeah, thanks once again, Tope. I think that's an easy one, but I'm going to try to break it down in a way that makes it very easy for everyone out there to have a clear understanding. An electronic medical record system, an EMR, is just a digital version of a patient's medical history and medical information, which is stored in a computer system or managed, as such, is basically just like having the paper version of your patient's medical record, taking that paper version and putting it in a computer and having it persisted there, making it easily available and always available. Basically an EMR has encompasses things like the patient demographics. We are talking about the patient age, address, insurance information, next of kin. All of these and many more is what constitutes the patient demographic, which is part of an EMR. We also have a typical EMR also has the medical history, the patient medical history, things like the diagnosis and treatment plan, the prescription records, lab test record, imaging, and all of that. Now, basically, when you are building an EMR, right, there are key components that you want to look out for. This will be, the patient data, right? You're looking at, having a component that manages the patient data. You're also looking at the components that manage the clinical documentation. So a typical EMR will have the patient data management feature where, the healthcare providers can keep and maintain the patient's demographic information. You also have the feature that would allow the same medical professionals to, record the clinical information about their patients. We talked about, the medical history, the allergies, current medication, lab tests, vital signs, and all of that. We also going to be looking at the order entry system. We want to be able to, request for services such as the imaging. The healthcare provider wants to order for an imaging lab test, imaging test. That will be done via the order entry system. Also the lab tests, the prescriptions, and all of that. And then finally, a typical EMR, or what I would say, modern EMR should support digital decision support. So basically, decision support is, is a kind of building intelligence into an EMR, that, helps, keep or prompt the care providers, pointing them to the right directions so that, patient can have, better healthcare delivery. So basically, to streamline, patient care, reduce error and enhance data interoperability, having a robust EMR is indispensable. So thank you very much.
All right, thank you, Mr. George. Dr. Raphael, I will be asking you the next question, but before then, I want to remind our participants, if you have any question or concerns, you can put it in the Q&A section. Thank you. So Dr. Raphael, I want to ask you, what do you think inspired the development of electronic medical record?
Thank you very much, Tope. I want to really appreciate the platform given to me once again to really share my experience and my knowledge as on a subject matter. Now, when we look at the healthcare system in developing countries, we will all agree that the healthcare system in developing countries have really suffered a lot of setback in so many ways, starting from when the patient comes to visit the hospital even to the last time that the patient, exits the hospital, whether, exit the hospital home or to the mortuary. So a lot of challenges are all over in healthcare system in developing countries. And that is one of the reasons, why the electronic medical records was inspired. And the development of electronic medical records was inspired by a combination of technological advancements, healthcare system needs, just like I mentioned earlier on, and a desire to improve patient care and overall healthcare efficiency. And just like Mr. George mentioned earlier on, they talking about electronic medical records, it is the digital version of the normal paper medical records that we struggle with in our various health institutions. And of course, the electronic medical records has brought about a lot of innovation into the healthcare industry. And there are several factors that contributed to the inspiration behind the implementation of electronic medical records. I'm going to just mention 6 out of them if the time permits me. The first one is technological advancements. Now, where we talk about the computing technology, and if you agree with me, during the later half of the 20th century and into the 4th century, and the visibility of strong managing and retrieving vast of amount of data electronically became increasingly very practical. And this is one of the reasons why the technology was introduced. And also talking about the digital storage and processing. And I would say that the availability of digital storage and processing capability made it very possible to move away from paper-based medical records keeping to more efficient and scalable electronic system. Now, moving into the second factor, that's talking about the patient care and safety. Now, this is very, very important as well, because improved access to information is very, very important. And electronic medical records aim to provide healthcare professionals with quick and easy access to a patient's complete medical history, which includes, past diagnosis of, the patient, the medication, allergies, and test results, which improves decision-making and also the patient's care. Now, EMR has also come to reduce what we call medical error. You remember we're talking about what really inspires electronic medical records. The EMR has come to also reduce medical errors. We know in our various hospitals, our doctors have very wonderful handwritings, and of course, these in many ways have really caused a lot of setback in the treatment of patients. And electronic medical records reduces the risk of errors that is associated with handwriting notes, which I mentioned earlier on, or the misinterpretation of paper records, clear and legible electronic entries will always contribute to the patient's safety at any point in time. Now, the third factor is care coordination. Now, talking about the care coordination as part of what inspired electronic medical records is that interoperability is one of the major aspects of it. There is one thing for EMR to be designed. Another thing is for this EMR to be able to have access to integrate with other software in another healthcare facilities. So this aspect of interoperability is very, very essential, and we need to take it very, very serious. So because in the era of paper records, it is very, very, very difficult for easy health information exchange. And that is one of the reasons why EMR brought about a lot of this innovation into the system. And under the care coordination, we talk about the coordination of care plan, which is very, very important. Electronic medical records will always facilitate the coordination of care plans among various healthcare professionals, which involves in a patient treatment, right? This is very, very particularly important for managing chronic condition and complex medical cases. Now, the fourth one, I'm going to talk about six. The fourth one is regulatory compliance and standardization. Talk about when you started, you made mention of the data protection, the compliance and what have you. We really want to appreciate, the government of the federal government of Nigeria, who has really made it very, very, compulsory that data protection is very, very essential in everyday activity, not only in healthcare industry, in every other industry country. And so also other developing countries are also, looking into this. So the regulatory is very, very important when it comes to, compliance. The government will enforce law. Just recently, President Ahmed Tinubu just passed into law. That was, I think, sometimes in May or June, the Nigerian Data Protection Act into law. Initially, we're making use of Nigerian Data Protection Regulation, but now it has become law. It has become something that every citizen of this country must be very aware that protection of data is something that's very essential. And in the health handle data, and data is equal to life in healthcare industry. So any error in data that is related to any patient is something that can lead to a grave, consequences, which must be very, very, looked into. The fifth one is efficiency and cost savings. Now, streamlining administrative process. Electronic medical records will always streamline administrative tasks, which will reduce the reliance on manual records way of keeping patients' information and administrative overhead. And this will lead to increased efficiency and cost saving for healthcare organizations. If you know that, in the time past, the cost of printing the case note of the patient, the cost of printing different forms in the patient's case note is something that is so enormous, and it is cumbersome for the government. So electronic medical records, has come in to reduce all these costs in order for, the healthcare facility to channel the finance into another very, profitable areas, which is very, very essential. Now, let me just quickly preface by talking about the sixth one. That is talking about the advancement in health informatics. Mr. George, said something, related to that when he was talking. Now, the health informatics field is a very, very essential field in the area of, digital health and electronic medical records. And the emergence and development of the field of health informatics, which combines the healthcare information technology and computer science, played a very crucial role in shaping the concept in different ways. So the development of electronic medical records, was inspired by a confluence of technological progress, a commitment to improve patient care, the need to better the care of coordination and compliance with regulation, which I mentioned earlier on. So in rounding up, electronic medical records will continue to evolve in response to ongoing advancement in technology and the evolving needs of the healthcare industry. It is very, very essential to know all this area and to really apply them the way it should. Thank you very much.
Thank you very much, Dr. Raphael, for that. I think for me, I've learned a lot. From what you just did, this is quickly, maybe in 10 seconds. I see from your bio, and I've been saying this EMR and EHR. What is the difference?
Okay. Sometimes we miss the EMR and the EHR, together. Now, the EMR is basically focused on, the activities that is taking place within the hospital premise, within a particular hospital environment, right? Talking about the communication from one particular unit, from one particular department to the other. So the EMR facilitates ease of this communication and health information exchange. Now, talking about the EHR, electronic health record. Electronic health record is much more, extensive in nature, whereby, this cuts across, this goes beyond the shore of the hospital environment, even beyond the shore of the country. For example, if a Nigerian patient, moved to Ghana, for instance, now, and the person wants to continue the treatment without any hiccup, it is with the aid of electronic health records, because of the interconnectivity and interoperability and the robust, technology nature that is embedded in it, that makes it to be very easy for, people to be able to have access to healthcare even beyond the hospital environment. Thank you very much.
Thank you very much, Dr. Raphael, for that. And I think it has really increased my knowledge, because I know in library science, they have such that you have these interlibrary services that one library collaborates with others. So I get that now. Thank you very much. So Abdulhamid, my question would be for you to kindly share successful impact stories from the implementation of EMR.
Yeah, thank you, Tope, and thank you, Dr. Raphael. I think that was quite insightful. Yeah, there's a lot of success stories, of course, when we talk about EMRs or EHR implementation. So I guess we'll just talk about a few of them. Maybe starting from home in Nigeria. Here, I know that University of Port Harcourt in Nigeria implemented EMR system sometimes some few years back to enhance patient care, and the hospital saw a notable reduction in the time required for patient registration and retrieval of medical histories. That's the fundamental reason why EMRs are implemented anyway, so that was no surprise. But there was also a significant improvement in the healthcare, total complete healthcare delivery across the hospital as well. So that's a very good success story from a public health institution, which is the University of Port Harcourt. Then you have the Kenyatta National Hospital in Kenya, still moving away from Nigeria now. EMR was successfully implemented, and it helped to improve patient care and administrative efficiency. And because they now have those records, like Dr. Raphael has been saying, when you convert those records from paper to electronic form, there's a lot of advantages that you can get. So because of that, the hospital reduced errors in prescription and diagnosis. And this led to better patient outcomes and a more streamlined healthcare system. So in Uganda also, they call theirs the HMIS, Health Management Information System, but it wasn't too far off. Inside that Health Management Information System, there was implementation of EMR. So, and that really helped because there was enhanced data collection and reporting, and it led to significant better disease surveillance and also resource allocation as well. And these things have been very, very valuable and very helpful in managing diseases such as malaria and tuberculosis in Uganda. So that was also very impactful in Uganda. Then when you move from Africa, maybe a few examples here and there. They have a lot of examples because, with the measurement of impact, I think when you go to the Western world, I think they do a better job of that because they are at this kind of advanced stage. So for Cleveland Clinic, for instance, they implemented EMRs, of course, to improve patient care, and they saw a 50% reduction in medication errors. And there was also 30% reduction in patient wait time. All of this will lead, of course, to increased patient satisfaction. Then there's the Jessinger Health System. They adopted EMR also to enhance patient engagement, and accordingly, they recorded 23% increase in patient satisfaction, and then they had a 40% reduction in duplicate testing, leading to a lot of cost savings. And maybe to round it up will be our EHA clinics here in Nigeria as well. EMR implementation has improved patient care. It has helped to reduce errors, also to enhance care coordination. And it has also increased patient and provider satisfaction overall. So I think there is no understating implementation of EMR or EHR will lead to significant improvement in patient care across the health facilities and across the entire country as well. Thank you.
Thank you very much, Abdulhamid. And in fact, I was just smiling while you were saying this, because I recall those days when we were some years back, when there were no phones, no all of these gadgets that we have now. When our parents want to write letters, they will buy like 3 exercise books and will continue to write letters from midnight till morning for them to send across to people. But all of that now has reduced. All right, so Dr. Raphael, please, could you tell us the important principles that need to be followed when developing and implementing EMR?
Okay. Thank you very much once again for this another opportunity that you have given on to me. Now, looking into the principle that is needed to be followed when developing and implementing electronic medical record. This is one of the very vital aspects that everybody needs to know, particularly in healthcare industry. Now, developing and implementing electronic medical records requires some careful consideration, of various principles to ensure the system's effectiveness, security, and usability. Very, very important. And there are some principles, very important principles that we need to look into, that we need to follow in the area of development and implementation of electronic medical records, which I want us to really look into. The first one that we need to talk about is the user-centered design. This is very important. It's part of the principles that needs to be followed. When designing electronic medical records, one thing needs to be put in mind, that is the user, that is the end user, those people that is going to make use of this application. Very, very important. Most of the application that we have been, seeing has always been, particularly the third-party, application, whereby it would have been already designed and then load over, a particular healthcare facilities without putting into consideration the people that are going to make use of this, particular solution. And this has made electronic medical records not to function the way it should in most of the developing countries. Because when you want to design something from afresh, it's very important that you bring into, the center table those people that are going to make use of this particular, solution, get their input into it. And by the time you get them into it, definitely, by the time, this solution is completed, it will be very easy for those users to be able to, adapt it to whatever environment they find themselves. Number 2, we talk about the interoperability. Talking about the principles now. The principle 2 is about interoperability, which I've mentioned earlier on, and I wouldn't want to waste much time on that. Talking about having handshake of different, electronic medical records to be able to communicate and exchange health information for proper, effective, and efficient care of patients' treatment. Number 3, we talk about the security and privacy, which also I've mentioned earlier on. At least I'm going to talk more on Nigeria as part of the developing country, right? Mr. Abdulhamid, was mentioning, other countries like Uganda, Kenya, and what have you. And I believe this country will also have their own privacy policy. They will have their own privacy act as far as patient data is concerned. The NDPA, Nigeria Data Protection Act, which was signed into law, has become a very strong law for every healthcare institution to handle patients' information with utmost respect. We all know in the world that the most expensive tool, even much more expensive than crude oil in the world today, is healthcare data. The hackers are going for healthcare data than any other data in any industry. And this is one of the reasons why the protection and privacy of this vital tool is very, very important. Number 4, we talk about the standardization of data. This standardization of data is very important. We all see what happened in different places. I will cite as an example of a place that I went to, a particular facility that I went to, and I saw the way they were capturing the patient data, the way they were processing the patient data. I looked at it and I asked a question. I said, how do you think a proper decision can be made with the way you are capturing this data? And the next thing the person told me was that, oh, this is the way we have been doing it. So this is how they said we should be doing it. So if there are no standardization of data, right, the format at which data should be collected, there will always be a problem in the area of decision making. Then number 5, talking about the scalability and flexibility. I'm not really going to dwell much time on that, but the design of the EMR system is supposed to be scalable and also to be very flexible, adaptable to accommodate the evolving need of healthcare organization. This is also very, very important. Now, number 6, training and education is part of the principles that needs to be followed. There are so many software we have today, and most of the people making use of it are not well trained. And this is one of the reasons why we're having problems in the implementation of electronic medical records in our various facilities. When proper training and education is given to the end users, they will be able to have the confidence to make use of this tool effectively in a way that is going to promote healthcare system in the developing country. Now, the 7th one is about the clinical decision support. Very important. I don't want to really waste much of our time because our time is limited. Number 8 is talking about the audit trail and accountability. Now, the EMR, should follow this principle. That is, knowing who and who is having access into the electronic medical records. The log should show who have been given access. The log the EMR should have a kind of features that should have a kind of a role-based control access, for whoever that is going to access this information, so that everybody will be accountable to whatever they are going to do. Then number 9, we'll talk about the engagement with stakeholders. Now, talking about this engagement, this involves key stakeholders, just like healthcare professionals, administrators, even patients are part of the stakeholders. Electronic medical records must not be designed in abstract. It must be designed by carrying along different stakeholders to be involved. Even patients should be carried along in the aspect of this for it to be very, very effective. And lastly, number 10, talking about the regulatory compliance. Of course, this will be reoccurring in most of our discussion today. Regulatory compliance. It is very important. One of the things that makes people to do certain things in any industry is force, using the application of force. When the law is made, the government needs to enforce this law on people, making people to be able to be compliant with the regulation of what is going on in that particular industry. And by adhering to these principles, developers and implementers can create electronic medical record systems that are not technically sound, but also align with the need of healthcare providers, patients, and regulatory framework, which will contribute to improve patient care and healthcare delivery in our healthcare system, particularly in the developing countries. Thank you very much.
All right, thank you very much, Dr. Raphael. Talking about the factors and the principles, Mr. George, could you kindly tell us the existing interoperability gaps that could impact on implementing electronic medical records in especially developing countries?
Yeah, thank you very much. I want to start by talking about the experience we had during the COVID-19 intervention. You know, our clinic was so much involved in the COVID-19 intervention in Nigeria. So I was part of a team that was managing the EMR that we are using. At that point, we had lots of partnership with people, you know, who wanted to, you know, share data with our system, you know. And one of the things that there was a bit challenging for us, for each of these partners, we had to implement a new feature to accommodate, you know, the data, you know, they are sending to us or the ones that we are sending back to them. So imagine when we are talking about having like 5 partners, you know, for each of these, we had to basically design new features or functionalities to support their needs in our EMR. And you can imagine how much time and resources that we put in, you know, to making sure that these systems work together, you know. And the issue we are talking about here is, you know, having diverse systems. You know, most of the people engaged in the business of building EMRs today basically do not follow any, you know, non-standards, basically. So people we just end up building bespoke applications that are not able to talk to one another. So one of those gaps is having this diverse system, bespoke application designed to meet specific needs of these individual healthcare providers. Another problem, another gap that exists there is, you know, lack of a standardized data format. Dr. Raphael has talked a lot about data interoperability, you know. For me, I think this is one of the key gaps that exist right now in terms of in terms of implementing, you know, electronic medical records. There are most of the EMRs that I have experience working with do not implement any standard, and that is one of the reasons in EHA clinics, after having, you know, had this experience during the COVID-19 intervention, we made a decision, you know, to adapt, you know, standards, you know, international standards in building our own EMR, and I had the opportunity to lead the team. So basically, what we tried to do was to make sure that, you know, in building our EMR, we follow a certain standard, so that if we had to have any kind of partnership, you know, that provided that their system implements the same standard, we're able to exchange data without any hindrances. So lack of standardized data formats and coding systems makes it difficult for EMRs to communicate with each other. Harmonizing these standards are crucial. They're very crucial and critical, and we cannot talk about digital interoperability without really, you know, looking at the data standard or standardization. Another key gap that exists is infrastructure. Mm-hmm. You know, especially in the context of Nigeria and also developing countries, there is limited access to high-speed internet and reliable power sources in most of the areas. You know, once you move out of, you know, the cities here in Nigeria or any other developing country, you find out that your access to internet is very limited. And, you know, we are looking at how we are going to like implement or, you know, popularize the use of electronic medical records. And this will include, you know, healthcare facilities located in these rural areas. And if we do not have these infrastructures, you know, ready, you know, for their use, this is actually really going to impact, you know, that objective. In fact, we also have experience in our clinic. You know, we have this program called REACH. One of the key objectives of REACH is to, you know, give access to quality healthcare to, you know, people that are living in low-income areas. And I had the privilege also to help provide solutions that the healthcare workers are using. One of those challenges we're still facing tomorrow is that of access to data and data reliability. And for that, one of the solutions that we have provided so far is to build them a streamlined application that, you know, that has offline capability, you know. So infrastructure is a key, you know, gap in the development of EMR. Dr. Rafa has also talked about literacy, training and all of that. Digital literacy, unfortunately, is still high in this part of the country, right? There are no adequate training or resources. Most softwares that are being built these days, there are no proper documentations that are provided. People hardly have enough training, to be able to effectively use this EMR. This is also very key. Knowledge is power. And if there is inadequate training, that really, is a very critical, issue that needs to be addressed. Overall, addressing these interoperability gaps in Nigeria will require a lot of effort, not only on the part of government. It needs to be a collaborative effort between the healthcare providers, government, and IT experts. We need to develop, standardized data formats. Very critical. I also had the opportunity to speak to some, guys, who had interest in standardizing, leading data standardization of digital health information in Nigeria. And of course, they're going to be having some Kenyatta in a few weeks' time. So a lot of people are having interest in that. So, and that is good news for us. So there has to be this, collaborative effort between government stakeholders like us here, IT experts in developing these standardized formats, and investments in robust IT infrastructure can pave way for successful EMR implementation. Thank you very much.
Yeah, thank you very much, Mr. George. Please, participants, if you have questions or any concerns, kindly share in the Q&A section and not in the chat, please. So looking at our discussion so far, we've talked about the principles, the interoperability gaps. Now, Abdulhamid, please, could you let us know what are the ethical and legal bottlenecks in the implementation of EMR?
Yeah, thank you, Tope. So I think, there are quite a lot of ethical and legal bottlenecks in implementation of EMR, just like with any new technology for that matter. So key, I think top of the list usually will be the patient's privacy and data security. This is really, really top because safeguarding the privacy and security of patient health information is quite critical. Yeah, so healthcare providers that have EMRs or other forms of access to patient data must ensure that they comply with all applicable regulations. In Nigeria, here you're talking about the National Health Act 2014. You have the Nigerian Data Protection Regulation, NDPR, which Dr. Raphael talked about. They just passed it now as an act. Then you have the Data Protection Impact Assessment. If you are in the United States, of course, you have the HIPAA, the Health Insurance Portability and Accountability Act. And then in the EU, you have the GDPR. All forms of data security regulations, you have to make sure you comply with them so that you avoid legal and ethical challenges. Then there's data ownership and portability as well. That has to be very, very clear. Who owns the data, electronic health records by the end of the day? Because that's very significant in who has right for those data to be transferred from one healthcare facility or provider to another. If you do that wrongly or have breaches, it could lead into very critical ethical or legal issues as well. So then you have the consent and access control. Sometimes we take it for granted, even if the patient comes in and you have access to the data, you must ensure that everything you want to do with that data, you have consent written and signed, which is something I know that some of our clinics, maybe more private clinics, do much better with here, but you still have those problems with public hospitals where you go and they just take your data without ensuring that you have that consent. And then not just the consent, when you get the consent, you have to put access control measures and proper data handling techniques in place so that you ensure that it's only people that are supposed to have access to that data that will have access to the data assigned by the patient during his consent form filling action. So data retention and deletion, even if when you have the patient's data, how long can you keep the data? When is it right for you to delete the data? Then interoperability and data exchange, I think a lot has been said about this. You have to make sure while you are trying to make life convenient for the patient by transferring data from one ecosystem, one health ecosystem to another, you still have to make sure that access to that data, security of that data information is provided so that you don't send the information to an ecosystem where probably you do not have the permission. So that's also very critical. So then informed consent for research, this is usually overlooked. A lot of data, tons and tons of data, and eventually you want to use them for research, maybe AI or so. You need to make sure you have consent so that you use that particular data in accordance with the rights or that has been given or ceded to you by the patient. Then you have to be very fast as well, because there's a lot of legal jurisdictions which can vary across multiple countries. So as you operate within from one country to the other, or you move data from one ecosystem in one country to another, you have to make sure you understand all the rules and make sure you also abide by them accordingly. Yeah, because of time, I will stop there, but I'm not sure how you want to answer questions. I see there are interesting questions in the chat. So are you gonna?
Yes, we'll be answering those questions shortly.
Okay.
But before then, quickly, I don't know, George, can you in just 2 minutes tell us what we look out for in the future about healthcare delivery with EMR?
Yeah, thank you. Yeah. Again, I'm currently working on a project, where we're trying to improve healthcare and improve healthcare delivery by frontline health workers, using AI. So what that project is about is empowering these frontline workers to deliver better healthcare to people in rural areas. So, I mean, for me, the future of the electronic medical records looks great. I expect to see, improvements in, healthcare delivery. Just like I've mentioned, like imagine, having all of these, decision supports built into your EMR, having AI assisted, decision-making processes put in place. You can imagine how that will significantly improve, patient outcome. Of course, also you're looking at, so of course,
because of our time. Yeah, so maybe you will bring out those points in this some of these questions that are asked here. So there are 2 questions from Emmanuel here. I will be directing those to Dr. Raphael. One of them is, what measures can we put in place so that those who are digitally handicapped are not disadvantaged in receiving healthcare when EHRs are deployed? That's one of his questions. And secondly, how do we ensure active participation of patients in their healthcare through the use of EMR?
Thank you very much, Emmanuel. Let me start by the first question. That is, let me just quickly check the question again. Sorry.
All right, so the question is, what measures can we put in place so that those who are digitally handicapped are not disadvantaged in receiving healthcare? So 1 minute for that, please.
Okay, thank you very much. What we need to do is to continue the awareness of, the use of electronic medical records. A lot of people does not have the knowledge of this, even the healthcare workers. I was on admission, about 2 weeks ago, and while I was in the bed in the ward where I was, the ICT unit of that, that hospital came around to start planning on how to start teaching the nurses on how to make use of the EMR. And I could hear the nurses saying that, okay, what nonsense is this? I'm working here, you're still asking me to come and be learning this, right? And which is something that we need to really look into. People's orientation needs to be changed. Not only the patient, not those who are, digitally handicapped, in the part of the patient, also in the part of the healthcare workers. Because if healthcare workers are not good in this area, there is no how they can perform what is expected, to the patient. So both patient and the healthcare workers need to be reorientated and give them the sound knowledge and the purpose, the importance of EMR, so that everybody can be on the same platform and make this EMR to work effectively. Thank you.
Thank you very much, Dr.
The
second question is, how do we ensure active participation of the patients in their healthcare through the use of EMR?
Yeah, it is still part of what I said earlier on. Patients is part of the stakeholders in healthcare industry, and they must not be pushed aside. If there's going to be any improvement or development in healthcare industry, patients must be carried along on how to use it. There are some patients that cannot even make use of some digital phone that we're using these days. But when they are well taught and the people living with them are given this knowledge, they can be helped to go along with the trend of the system. It is very important that the patients are given adequate orientation each time they come into the hospital in a way that is going to be very much interesting and make them to have an open heart to accept these developments. Thank you very much.
All right, thank you very much, sir. We can always make use of references to the phones that we are all using today. Even the old woman in the village knows how to use the normal phone. So quickly, Abdul Hamid, somebody is asking, is there a standard EMR system that is adopted in Nigeria?
Yeah, I'm not sure that there is. I think everyone is setting up. George has already spoken about that a little bit. You have everyone setting up these islands of EMRs based on what you think works best for you. We still don't have that. That's why he was saying initially that we built our own, the EHA clinics built its own EMR based on certain standard, so that in the future, when there will be an agreed standard on which to operate, we're already there. So we don't have to start from the scratch again. But there's no any adopted EMR. But maybe, I know maybe some states, because I was in Lagos last time when we had this COP about EMR, yeah. Lagos has really gone far. So they are having this coordination and setting up interoperability and connectivity within their EMR so that they can function as a single unit. But nationally, I don't think there is anyone. And because this is key, let me just take 20, 30 seconds. The question on capturing the digitally disadvantaged is very, very key. That's why what we first of all do here is the design phase, inclusive design. We ensure here at EHA that you design any software, not even the EHR for that matter. You follow the principles of inclusive design, making sure as many people, even people that are digitally disadvantaged, can have access to those platforms or those solutions. And you have to also put assistive technologies, screen readers, voice recognition software to assist people that have those type of disabilities. If it's also purely digital disabilities that Dr. George also talked about, infrastructural problems that lead to people to become digitally disadvantaged, we make sure we make the software or the EMR maybe offline capable, so you can even have access even for the platform or solution to work even while you are offline. And then sometimes we also do mobile health clinics, right? Take the clinics itself with the EMR, move it to the people so that you move that infrastructure to people where they lack some of those basically digital solutions that or digital resources that they can use to access those applications. Then you have to get continuous feedback mechanisms. You need to hear even people you think are digitally okay. When you get feedback, you might be surprised that some of them move into the digitally disadvantaged for certain reason, that you incorporate that into your design.
Yeah, I agree. Thank you very much. I wish we have a whole lot of time. This is really informative. So a quick one, just in 10 seconds. This is to Dr. Raphael from Mohammed Fauzi. How do we ensure data is protected without infringing on people's privacy?
Data can be
30 seconds.
Okay, thank you very much. Data can be protected without infringing into anybody's privacy. Simply, if you can just follow the principle. Like I said earlier on, the Nigerian Data Protection Act covers so many things which ensure that every personal sensitive data must be protected. So this is already in the law, and of course it must be followed, and there are penalties if you fail to follow it, or you are involved in the breach of this data. There are penalties according to Nigerian Data Protection Commission.
Thank you very much,
Dr. Thank you very much.
Thank you very much, our panelists and our participants. Our time is up. I wish we will have another section of this very interesting topic. Thank you very much. And I'm sure our panelists, you will be ready when we call on you again next time. Thank you so much, our participants. Dr. Raphael, George, Abdulhamid, thank you so much for your time. Bye, everyone.
Thank you.
Thank you very much for the opportunity.
All right, thank you so much. Bye, everyone. See you in the next webinar.
Bye.
Look out for our webinar on all the social media platforms. Bye.
Bye.